Now we're going to take a look at a group of disorders that are labeled the elimination disorders. So children with elimination disorders repeatedly urinate or pass feces in their clothes, in the bed, or on the floor. And what makes this a diagnosis is that they have already reached an age where they are expected to control these bodily functions, and these symptoms are not caused by physical illness. So the first one we're going to talk about is urinalysis. Urinalysis is the repeated involuntary, or in some cases intentional, bedwetting or wetting of one's clothes. It typically occurs at night during sleep, but may also occur during the day. Children must be at least 5 years of age to receive this diagnosis, and the problem may be triggered by a stressful event. Very often, people with this disorder typically have a close relative who has had or will have the same disorder. And very often, in most cases, quite honestly, it corrects itself without treatment. In terms of some of the reasons why this disorder occurs, research has not necessarily favored one explanation over the other. The psychodynamic theorists explain it as a symptom of broader anxiety and underlying conflicts. Family theorists point to a disturbed family interaction. Behaviorists often view it as a result of improper, unrealistic, or coercive toilet training. And our biological theorists suspect a small bladder capacity or weak bladder muscles. The next elimination disorder we're going to cover is encopresis, and this is repeatedly defecating in one's clothes. It's less common than urinalysis and less well researched. The problem is usually involuntary, seldom occurs during sleep, starts after the age of 4, and is more common in boys than girls. And no surprise, it often can cause intense social problems, shame, and embarrassment. In terms of the cases of this disorder may stem from stress, constipation, improper toilet training, or a combination of all three. The most common treatments are behavioral and medical approaches, or a combination of the two. And some researchers found that family therapy can be helpful as well. So this mini lecture took a look at the elimination disorders. Next, we will do a mini lecture on long-term disorders that begin in childhood.